Hello. Today I will be informing you on dementia. By the end of my speech, the audience will be better informed on dementia and have a clear understanding for those who suffer with it. Whether it be a loved one, a friend, or a stranger, it is important that we all have an understanding on dementia and how it affects their daily lives. It is helpful that more people are aware and educated so that they're able to help and be more understanding than critical. Can you imagine forgetting how to dress on your own? Forgetting who your loved ones are? How to cook or even play your favorite games? Dementia is not a disease itself. It is a term used to describe the many symptoms including memory loss, thinking, and communicating. My knowledge on dementia is from my CNA training and many hours of working experience with the elderly, and also lots of research to keep my knowledge current. As my audience, you should care about my speech because it will benefit you to have a better insight on those with dementia in order to feel for those who suffer with their daily lives around you. After my speech, hopefully you will have more compassion for the elderly and you will be more considerate on their thoughts and feelings. I will be going over dementia and its causes and symptoms and how it is diagnosed and treated. This information may seem overwhelming at first, but it is very simple to understand gradually. As I previously mentioned, dementia is not a disease. It is a term used to describe many symptoms such as memory loss, thinking, problem solving, and communicating. Another major symptom is sudden random changes in a person's mood. We have to keep in mind that they do not have full control over their moods and emotions. They could be happy 1 second and then come across an emotion they can't express and appear to be upset for no reason. You should remind yourself to be mindful, and redirect them back to a more positive mood rather than get upset with them. Dementia is caused by damage or changes in the brain. Alzheimer's disease and stroke are the most common causes of dementia, and they are irreversible as well. There are many other causes that are sometimes treatable, such as brain injuries, alcoholism, or HIV and AIDS. Then there are some that cannot be treated, such as inherited dementia, Parkinson's disease, and head injuries, according to WebMD.com. There are many other causes, but these are some of the main ones. Now that you understand what dementia is and some of the causes, you may be wondering what the symptoms are. How do you know if someone has dementia? There is no specific symptom for dementia. Symptoms may vary depending on the cause. According to MayoClinic.com, symptoms may include difficulty communicating, problem solving, handling tasks, planning and organizing, coordination, confusion, personality changes, depression, anxiety, inappropriate behavior, paranoia, and hallucinations. From work experience, I have witnessed elderly people go through all of these symptoms in one day. Can you imagine living like this? You have to put yourself in their shoes. Dealing with all these symptoms can be very overwhelming. We all go through mood changes when we are overwhelmed. We also have to remind ourselves that they may also feel embarrassed about having to depend on people for daily living. Everything they used to normally do is erased from their memory. Can you imagine having a scattered memory on your loved ones? If you see your loved ones experience any of these dementia symptoms or any form of memory loss at all, it is important that you contact their doctor immediately. Depending on the cause, it may be treatable. Now, I know you're wondering what treatments they could possibly have for dementia. To treat dementia, you must first figure out the underlying cause in order to see how it should be treated. According to Dementia.com, in the case dementia cannot be treated or cured, the goal is to improve or control the symptoms. Along with medical treatment from a doctor, from experience I have learned many other ways to treat dementia. It is important to keep a safe environment. You need to take safety precautions just as you would with a child. Since those with dementia suffer from memory loss, they forget the safe and right way to do things. Keep any sharp objects, chemicals out of sight, and place child locks on things that cannot be used alone. The floors should be cleared, bed rails should be up, for sleeping and to prevent falls. If your loved one has repetition of problematic behavior, an intervention is also helpful so that you're able to sit down, critically think, and try to figure out the best way to prevent this issue from happening again. Making things easier for them to do on their own, such as eating or getting dressed, is also better. That way they don't have to think too hard and get upset. Having someone come in and speak to them about their problems occasionally is also good. It's always good to hear from someone that really understands what you're going through. Physical therapy can also help them learn further motor skills, and they will also become a little bit more independent. That makes them feel better as well about themselves. There are many little things to do to help the disease. The best thing to do is keep them active and entertained to refrain from them getting hurt or going into a depression. Now that you have a clear insight on dementia, how do you feel about elderly people diagnosed with dementia? I hope you have a clear understanding as to what they go through in their daily lives and what you can do to help. I informed you on exactly what dementia is, what causes it, the symptoms, and how it is treated. Next time you see your loved one or even a stranger, show some compassion. Be patient. Ask yourself, how would you feel if you had to depend on people every day that didn't completely understand you? Thank you. Now I can show you a video on pictures of things that involve dementia and a PowerPoint slide. This is a dementia brain next to a regular brain. As you can see, it's very different. Keep them safe, or this is how they will end up.
Just about any experienced nurse aide will tell you, caring for residents with dementia has its own special challenges, but it can also be rewarding. There are moments when residents may be combative or say and do things that are hurtful to you and others, but they can also be affectionate and playful, and they are often grateful for the help you give them, or the time you take to talk with them. This nurse aide has focused her career on working with dementia residents. She knows firsthand the challenges and the rewards.
So Florence, you want to walk today? You want to get out the chair and walk? Yeah. Okay, Kay, you're going to brush your teeth now, okay? Yeah. All right. Oh, they're dancing. What about you? We could dance. Ooh, you are, see, you're better than I am. Look at it. I'm pleased with what I do. And especially when you do something to them and you see that smile, it makes you feel good to know that you are doing doing something good.